Before we begin your training on how to prevent the spread of bloodborne pathogens during body art procedure, let's go over some vocabulary. These words and phrases are important because they are commonly used in the industry and by health department officials across the state of California when discussing body art, bloodborne pathogens, risk factors, and prevention. I understand that you may already be familiar with some of these terms, but please pay attention anyway. You might learn something new. An acute infection is a classification of infection characterized by symptoms that appear rapidly but generally disappear within a few days. An antiseptic is a substance or chemical that destroys or inhibits disease-causing microorganisms on human skin or in mucus. In the body art industry, something is approved when it has been deemed acceptable by the regulatory authority, such as the health department. In the body art world, an artist is someone who performs tattooing, intradermal cosmetics, and certain body piercings, and is responsible for complying with the provisions of such. The term artist is used, rather than practitioner, because of the amount of individual skill and expression involved in each procedure. A blood exposure incident is when the skin is pierced through such events as a needle stick, cut, or abrasion from a material contaminated with blood from a client, or if the eye, mouth, or other mucous membrane or non-intact skin comes into contact with blood or blood-contaminated material from a client. A bloodborne pathogen is a disease-causing or pathogenic microorganism that is present in human blood. These pathogens include, but are not limited to, hepatitis B or HBV, hepatitis C or HCV, and human immunodeficiency virus or HIV. We'll discuss these pathogens and others during this course. On an individual level, what is or is not body art is subjective and very personal. However, for the purposes of this course, and as determined by the state of California, body art is defined as the practice of physical body adornment by permitted establishments, operators, and registered body art technicians utilizing, but not limited to, the following techniques: body piercing, tattooing, permanent cosmetics, branding, and scarification. This definition does not include practices that are considered medical procedures by the state medical board, such as implants under the skin, which must not be performed by a body art facility. Any person who is registered with the regulating authority, like the health department, who controls, operates, manages, conducts, or practices body art procedures at a body art facility and who is responsible for compliance with these regulations, whether actually performing body art procedures or not. A body piercing is the creation of an opening in the human body for the purposes of inserting jewelry or other decoration. This includes, but is not limited to, piercing of the lip, tongue, nose, eyebrow, or navel. Body piercing does not include piercing the ear rim or earlobe with a sterile, disposable, single-use stud or solid needle that is applied using a mechanical device to force the needle or stud through the ear. A body piercing studio is a permanent, non-dwelling building or portion of a building designated by a license holder and located in accordance with applicable local zoning codes where body piercing is performed, completely separated from living quarters. These can also be called studios. Branding is defined as the burning of skin with a heated metal wire, iron, rod, or stencil with the intent of producing a permanent scar or mark. An infection is considered chronic when it is long-lasting or recurs regularly. In the body art industry, a client is a person requesting the application of a tattoo or body piercing. In the case of bloodborne pathogens, something is considered contaminated when there is the presence or reasonably anticipated presence of blood, bodily fluid, or other potentially infectious materials in or on the surface of an item. In the body art industry, contaminated waste is any contaminated material generated during body art procedures that is to be disposed of. A cosmetic is an article or substance intended to be rubbed, poured, sprinkled, sprayed on, or otherwise applied to the human body for cleansing, beautifying, promoting attractiveness, or altering appearances. This also includes ingredients of such articles, except that the term does not include soap. A disinfectant is an agent that kills disease-causing microorganisms on inanimate objects or surfaces. An ear piercing is the creation of an opening in an individual's earlobe with an ear piercing gun to insert jewelry or other decoration. A facility to the body art community is any room, shop, or space where body art procedures are performed. A hand washing facility is a sink equipped with hot and cold or tempered running water under pressure, used for washing hands, arms, or other portions of the body. An infection prevention control plan is a written plan that applies to all those who perform tattooing, the application of permanent cosmetics, body piercing, branding, or scarification within a California body art facility. It describes how the applicable requirements of California's regulations will be implemented. It is designed to eliminate or minimize employee and client exposure to bloodborne pathogens and other communicable diseases. An informed consent form is a document that every client must read, fill out, and sign before any body art procedure. The consent form must include a description of the requested body art procedure, a description of what the client should expect following the procedure, including any medical complications that can potentially occur, a statement informing clients of body art permanence, and post-procedure instructions discussing how to care for new body art and piercings, what clients should and should not participate in while body art heals, and signs and symptoms of possible infection in body art and piercing sites. In the body art industry, an instrument is defined as equipment for tattooing, applying permanent cosmetics, body piercing, branding, or scarification. Such equipment includes, but is not limited to, needles, needle bars, needle tubes, forceps, hemostats, tweezers, pliers, blades, scalpels, branding wires, irons, rods, stencils, or other implements used to insert pigment, pierce, puncture, burn, cut, or be inserted into any part of the human body for the purposes of making a tattoo, permanent hole, or scar. This term also applies to studs, hoops, rings, or other decorative jewelry, material, or apparatuses intended to be inserted into any part of the body for the intended purpose of placement in a hole resulting from piercing. Jewelry is defined as any personal ornament inserted into a pierced area. To be appropriate for body art, jewelry must be made of surgical implant-grade stainless steel, solid 14-karat or 18-karat gold, niobium, titanium, or platinum, and be free from nicks, scratches, or irregular surfaces. Jewelry must be properly sterilized prior to use. A medical history questionnaire is a document that every client must read, fill out, and sign before any body art procedure. The questionnaire must include whether or not the client may be pregnant, whether or not the client has a history of diabetes, cardiac valve disease, hemophilia, or other bleeding disorders, allergic reactions to latex or antibiotics, or herpes infections at or near the requested body art site, whether or not the client has a history of medication use or is currently using medication, including prescribed antibiotics for use before dental or surgical procedures, and any other factors that may put the client or body artist at risk for bloodborne pathogen exposure. All information provided on the medical history questionnaire is considered confidential. A minor is any person under the age of 18 years. A person is considered an owner or operator if they have ownership, control, or custody of any place of business or employment, including body art facilities. Permanent cosmetics is the name given to the application of pigments under the skin of a human being for the purpose of permanently changing the color or other appearance of the skin. This includes, but is not limited to, permanent eyeliner, eyeshadow, lip color, or areola color. A permanent hole is any hole produced by piercing or puncturing any part of the body with instruments intended to leave an opening in body tissue which an appropriate device or apparatus may be inserted. Permanent holes would include any body part newly pierced or punctured which is undergoing a healing process. The term also refers to any piercing, regardless of whether or not removal of a device or apparatus from the perforation would result in fusing or healing of the tissue or skin structures. A permit is a written approval from the regulating authority allowing an owner or operator to operate a body art facility. Approval is given in accordance with state regulations and is separate from any other licensing requirements that may exist within the local jurisdiction. Personal protective equipment, or PPE, is any protective clothing item that helps to protect the wearer from injury, heat, chemicals, or infection while on the job. This term is not exclusive to the body art industry. A piercing gun is a handheld tool that is used exclusively for piercing the earlobe and rim, into which single-use, pre-sterilized studs and clutches are placed and inserted into the ear by hand-squeezed or spring-loaded action to create a permanent hole. The tool must be made of plastic, stainless steel, or other material that is able to be disinfected. Pre-sterilized refers to instruments or procedure setups that are sold individually packaged and sterilized. Each package shall have an auditable sterilization lot number from a sterilization facility. This term applies to the immediate area where instruments and supplies are placed during a procedure. Registration applies to complying with all the requirements of the regulating authority and receiving a certificate of registration. Sanitization is the effective bactericidal and virucidal treatment of clean equipment surfaces by a process that has been approved by the regulating authority as being effective in destroying or significantly reducing the number of pathogens. It is not the same as sterilization. Scarification is the name given to the process of cutting skin with a sharp instrument for the purposes of producing a permanent scar or mark. A sharp is any object that may purposefully or accidentally cut or penetrate the skin or mucous membranes, including, but not limited to, needles, scalpel, blades, and razor blades. A sharps container is a puncture-resistant, leak-proof container that can be closed for handling, storage, transportation, and disposal, and that is labeled as a biohazard. Sterilization is, simply put, the destruction of all living organisms, including spores. A tattoo studio is a permanent, non-dwelling building or portion of a building designated by a license holder and located in accordance with applicable local zoning codes where tattooing or intradermal cosmetic application is performed. A studio should be completely separated from living quarters. Tattooing refers to the insertion of pigment under the surface of the skin by pricking with a needle or otherwise to permanently change the color or appearance of skin or to produce an indelible mark or figure visible through the skin. Universal precaution is the name given to various methods of infection control where employees take steps to appropriately treat all blood and body fluids for the purposes of preventing the spread of bloodborne pathogens. Universal precautions include hand washing, gloving, use of personal protective equipment, injury prevention, and proper handling of disposal of needles, other sharp instruments, and blood and body fluid contaminated products. A workstation is an area set up to perform body art procedures. A workstation can be a separate room or area that can be screened to ensure privacy when performing body art procedures on discretionary areas of the body. Body art is an increasingly popular mode of personal expression, but if body artists aren't careful, even simple body art procedures can have seriously negative health consequences. Recently, a Canadian law firm filed a $20 million class action lawsuit against a tattoo parlor, alleging that the parlor's employees had been using unsterilized needles over a 4-year period in which they tattooed as many as 3,000 people. One of those customers tested positive for hepatitis B after receiving body art at the parlor, whereas tests conducted prior to his procedure were negative. This one man initiated the lawsuit against the parlor, but many of the parlor's other former clients joined him in the suit. When body artists failed to follow proper procedures, they exposed their clients and themselves to serious danger. They also exposed themselves and their employees to potentially crippling financial damages. We're here today to teach you how to protect yourself and your customers from bloodborne pathogens and the many problems they can cause. My name's Tim, and this is Lily.
Bloodborne pathogens are disease-causing microorganisms, or germs, that can be found in the blood of infected people. Coming into contact with blood that is infected with a bloodborne pathogen exposes you to the disease caused by that germ. As a body artist, you'll likely come into contact with blood on a daily basis. You can never be sure that the person you are tattooing or piercing doesn't have a contagious disease, so you always need to take steps to protect yourself and your other clients from possible infections. This course will teach you those preventative steps and prepare you to do your job safely.
In the first section of this course, you'll learn how diseases are spread through blood. We'll focus on a few common pathogens, discussing how they attack their victims and how they are treated. Some of the diseases we will mention are not strictly bloodborne, but are still of particular concern to body artists. Once you better understand what you are trying to prevent, the next section will teach you how to prevent transmission. We'll discuss many prevention methods, including the use of personal protective equipment, hand washing, waste disposal, sterilization, and more. You will also learn about infection prevention control plans. You will learn what to do in case you become exposed to a pathogen and how to create and use your own plan. The Occupational Safety and Health Administration, or OSHA, requires that people who might come into contact with bloodborne pathogens in the workplace, including body artists, are trained to deal with this hazard properly. The state of California also has bloodborne pathogen training requirements for body artists. This course has been designed by Above Training Incorporated to teach the relevant OSHA standards and California regulations and comply with the OSHA and California training requirements. OSHA does not review or approve specific training materials, so the responsibility for ensuring that training is compliant with OSHA standards rests ultimately on the employer. There are established standards for preventing and managing potential and real exposure to bloodborne pathogens. We will now show you the OSHA and California standards and ask that you read them carefully. If some of the information is confusing, don't worry. We'll address the portions of the standards that are most important to your job later in the course. To view the OSHA standard, click the top link. To view California-specific information provided by the California Department of Industrial Relations, or DIR, click the bottom link.
Now let's learn more about pathogens found in your environment. Pathogens are tiny, microscopic creatures that cause diseases. Examples of pathogens include bacteria, viruses, and parasites. They can be transmitted or spread in many different ways, including through the air, on doorknobs, through a handshake, or even through contaminated water. Bloodborne pathogens, however, can only be spread through blood-to-blood contact. This blood-to-blood contact can happen either directly or indirectly. An example of direct contact would be if you had an open cut on your hand and that cut touched your client's blood or another body fluid during a procedure. Indirect exposure can happen if, for example, you were to touch a phone with contaminated hands. The pathogen would then be on the phone, and if someone touched the phone with a cut or scrape on his or her hand, the pathogen could be transmitted into that person's blood. Protecting yourself from blood-borne pathogens comes down to avoiding touching blood, a contaminated object, or other potentially infectious materials, sometimes referred to as OPIM. OPIM includes other human body fluids and any possibly infected human body tissue. So we know that direct and indirect contact transmission occur when an uninfected person comes in contact with an infected body fluid or an object or surface that has previously been contaminated. But what kind of contact will lead to infection? The first requirement for the infection is a sufficient quantity of the pathogen present in a body fluid. There are many kinds of body fluids such as saliva, blood, and semen, but not all body fluids are infected with pathogens. And some infected fluids might not contain a high enough concentration of the pathogen to make the infection possible. However, there's no way for you to know whether or not a body fluid is infected and whether or not the pathogen is sufficiently concentrated. So you should always assume that all body fluids are capable of causing infection and avoid contact with all fluids, just to be safe. A second requirement for infection is a host organism that is susceptible to the infecting pathogen. Simply put, not all people are susceptible to every infection. Many people develop immunity to certain diseases, meaning that exposure to the pathogens that cause those diseases would not result in infection. Some immunity occurs naturally. For example, it is more difficult to contract chickenpox for a second time because the human body has already developed the ability to easily recognize and kill the pathogen from a previous exposure. Immunity can also be created artificially. Injecting dead or weakened forms of certain pathogens can teach your body to recognize and fight those diseases in a low-risk situation. This process is called vaccination. As a body artist, you should definitely receive vaccinations for common bloodborne pathogens like hepatitis B, but vaccinations have not yet been developed for all the diseases to which you might be exposed. Plus, vaccination is not 100% effective. In rare cases, people can become infected with a disease to which they have previously been vaccinated. So even if you've been vaccinated, you must still be careful and take every precaution required to ensure your safety and the safety of your customers.
Another requirement for infection is an entry point. Your skin is the most important part of your immune system. If intact, it safely stops pathogens from entering your body. In order for infection to occur, a pathogen must find its way to bypass this barrier. Bloodborne pathogens usually enter your body through an opening in your skin, such as a cut, scratch, or scrape. If a pathogen finds a way past your skin, it can easily enter your bloodstream and begin using your body's resources to multiply and thrive. The majority of the principles you will learn in this course are designed to prevent pathogens from finding entry points to your body. This is the only sure way to prevent infection.
I've invited Dr. Cohen to teach you about a few serious illnesses that are caused by bloodborne pathogens. Dr. Cohen is an epidemiologist, which means he is an expert on diseases and the ways in which they spread.
Thank you, Lily. We'll start by talking about hepatitis. The word hepatitis literally means inflammation of the liver, and that's exactly what it is, a disease that causes inflammation or painful swelling of the liver. Almost all cases of hepatitis are caused by one of 5 hepatitis viruses. Each strain is identified by a letter attached to its name, A, B, C, D, and E. The A and E strains of hepatitis are not bloodborne, and hepatitis D is not commonly found here in the United States, so we will focus our discussion on hepatitis strains B and C. These are the strains to which you are most likely to become exposed as a body artist. Hepatitis strains B and C can be spread in a variety of ways. Infected mothers can pass the virus on to their babies during childbirth. Unprotected sex with an infected individual can lead to infection, as can sharing needles. Hepatitis can also be spread by direct contact with infected blood or open sores, and by indirect contact with contaminated objects. As body artists, your greatest risk comes from open sores and contaminated equipment, most notably sharp objects like needles used for tattoos or piercings. If your customer is infected with hepatitis, the needle you use will become contaminated. Accidentally sticking yourself with a contaminated needle could immediately expose you to this dangerous disease. Symptoms of hepatitis infection usually begin within 6 months of exposure to the virus. The symptoms are similar to those of the flu, so most people won't even realize that they're infected. When the symptoms disappear, usually in a matter of weeks, those infected might think that their illness has passed. Many people won't even experience symptoms of hepatitis infection until serious liver damage has occurred, including cirrhosis or scarring of the liver and liver cancer. This liver damage is often irreversible. In many cases, a transplant may be necessary.
Treatment for hepatitis is somewhat problematic. The early infection symptoms usually require no treatment, as the symptoms simply disappear after a couple of weeks, while the long-term liver problems are often serious enough to make treatment difficult. Prevention is a much better and easier option. A vaccination is available for hepatitis B at your local health department or doctor's office. In many states, body artists are required by law to receive the hepatitis B vaccine. But even if it isn't required where you work, you should still be vaccinated for your own safety. If you don't know if you have been vaccinated, check your medical records. If you haven't been vaccinated, get it done. Your employer should provide it at no cost to you. For more information about the hepatitis B vaccine, check out the CDC's explanation by clicking on the link in the Learning Extras. There is currently no vaccine for hepatitis C, so you must be especially careful to prevent exposure to infectious materials. We'll discuss ways to prevent exposure later in the course, but in large part, it consists of avoiding accidentally sticking your skin with potentially contaminated tattoo and piercing needles.
Human immunodeficiency virus, or HIV, is a nasty bloodborne virus that attacks the immune system by destroying certain white blood cells that are needed to prevent infections. When these cells are destroyed by HIV, the body is left vulnerable to disease. The Centers for Disease Control estimate that 1.2 million Americans are currently living with HIV. with 50,000 new infections each year. HIV infection often leads to acquired immune deficiency syndrome, or AIDS, a disease characterized by a severely weakened immune system. As a result of this immune deficiency, people with AIDS are prone to a variety of infections and illnesses that would never affect a person with a normal, healthy immune system. AIDS is fatal when untreated, and currently, AIDS treatment is extremely expensive and unavailable to many infected persons throughout the world. In 2007, 2 million people died of HIV and AIDS-related causes worldwide. HIV is most commonly contracted in one of three ways: sexual intercourse with an infected partner, contact with infected blood, and transmission from mother to child, either in the womb or via breastfeeding. HIV can be found in many body fluids, but it is most concentrated in infected blood. If infected blood comes into contact with an open wound, the disease will almost certainly be passed. Even if you are already HIV positive, you are not protected from getting it again. Like the common cold, HIV is constantly changing, but unlike the common cold, your body never rids itself of the virus. This means that you can be infected with multiple HIV strains at once. In many cases, a person infected by HIV will test positively for the virus 2 to 8 weeks after the initial infection, but this time period, called the window period, can take as long as 6 months. The virus's incubation from HIV to AIDS varies widely. There have been cases of people infected with HIV developing AIDS within 9 months, and with treatment, others have been able to delay HIV's progression to AIDS for up to 20 years. On average, HIV takes about 10 years to progress to AIDS. Although treatment will improve the life of a person infected with HIV, prevention is still the safest, easiest, and least expensive way to protect your body against HIV and AIDS. Scientists are working toward developing a vaccine, but there may never be a cure. Studies have shown that being quickly treated with post-exposure prophylaxis can reduce the chance for infection by 81%. So if you ever think you may have been exposed to HIV, see a doctor immediately. Most of all, be extremely careful with any sharp objects that might have been exposed to infected blood or body fluids. Staphylococcus aureus, or staph, is a class of pathogenic bacteria that is commonly found on the skin or in the noses of healthy people. Whenever there is a break in the skin, be it a cut, scrape, or puncture, a staph infection risk is present. In the past, most staph infections were relatively simple to treat using common antibiotics. Over time, however, some staph bacteria have developed resistance to these antibiotics. MRSA, or methicillin-resistant Staphylococcus aureus, is the most common drug-resistant staph strain, and in recent years has accounted for close to 2/3 of all staph infections. Staph infections, including MRSA, usually result from direct or indirect contact with infected persons or contaminated surfaces and objects. As with all infections, staph requires an entry point, and it frequently enters its victims through minor cuts, scrapes, or scratches in the skin. Keeping these areas clean and bandaged and washing your hands frequently will go a long way toward preventing staph infections. It is not uncommon for external wounds to develop minor staph infections that remain localized at the injury site. Such infections are treated relatively easily. However, if the pathogen is permitted to invade deeper into the body, it can cause much more serious infections, including septicemia, or blood poisoning. These invasive infections are frequently fatal. In 2010, there were 94,000 reported cases of MRSA in the U.S., and an estimated 18,000 of those people died. In most cases, the incubation period of a staph infection takes between 2 and 10 days. There is no vaccine for staph infections, but you can protect yourself by keeping any cuts or scrapes clean and bandaged and regularly washing your hands. Protect your clients by properly cleaning and preparing their skin before beginning all procedures. Make sure your clients know that if they see any excessive or persistent swelling and redness around their piercings or tattoos, that they should see a doctor right away. Group A Streptococcus, or GAS, is like staph in that it is a type of bacteria frequently found on the skin and in the throats of healthy people. But when GAS bacteria enter the blood, they cause infections that can turn deadly. Two such GAS infections are necrotizing fasciitis and streptococcal toxic shock syndrome, or STSS. Necrotizing fasciitis is a deep tissue GAS infection. It is commonly referred to as flesh-eating bacteria, but that's a little misleading. The infection does not exactly eat flesh. Instead, it releases a toxin that kills body tissue, causing it to appear as if it has been eaten away. STSS, like necrotizing fasciitis, is an illness caused by a toxin released by streptococcal bacteria in the blood. STSS is quite rare, but extremely deadly. In fact, 70% of cases result in death. Some GAS infections are spread via direct contact, but necrotizing fasciitis and STSS are not typically spread from person to person. Rather, they are usually caused by bacteria that are already present on the infected person's skin, which infect the person's body via an entry point. Good hygiene and cleanliness practices help to prevent these infections. Symptoms of GAS infections typically appear within 1 to 10 days of infection. As with staph infections, strep is most easily prevented by keeping cuts and wounds clean and bandaged. Make sure to stress to your customers the importance of keeping their new body art and the surrounding skin clean and protected from pathogens until they have sufficiently healed. You can also protect your clients by properly cleaning and preparing each client's skin before beginning any procedure. Diseases like malaria and syphilis are also bloodborne. Malaria, a parasitic illness carried by mosquitoes, is rare in the United States. However, the disease may affect immigrants and international travelers. Victims of malaria suffer from severe fevers, chills and sweats, and flu-like symptoms. If the illness goes untreated, it can cause organ failure and death. Syphilis is a dangerous bacterial infection that flares up in stages. These stages can extend over a period of years, with late stages of syphilis potentially affecting victims 10 to 20 years after the infection was first contracted. Syphilis tends to cause sores and rashes in its primary and secondary stages. In its late stages, which are rare but significantly more dangerous, complications can include damage to the eyes, brain, liver, bones, blood vessels, central nervous system, and heart. The late stages of syphilis can be fatal. In most cases, malaria spreads when people are bitten by infected mosquitoes rather than spreading from person to person, and syphilis is usually transmitted through sexual contact. Body artists should be careful, though, because there is the possibility of malaria or syphilis transmission if blood from an infected person comes into contact with another person's bloodstream. This can happen a few different ways. For example, there have been rare cases of syphilis and malaria being spread during blood transfusion, and open wounds and jabs from contaminated needles can both provide potential entry points for these dangerous infections. Symptoms of malaria usually show up 7 to 30 days after a person is infected with the parasite, and symptoms of syphilis tend to appear 3 weeks after infection, although the incubation period can range from 10 to 90 days. The spread of malaria and syphilis through body art procedures can be prevented by the universal precautions that you will learn about later in this course. Such precautions include sanitizing or sterilizing surfaces and equipment in your workplace, properly discarding tattooing and piercing needles after every body art procedure, and keeping wounds safely covered. Herpes simplex is a viral disease that manifests itself in a variety of different ways, all of which are characterized by the appearance of sores or blisters in cycles in the affected area. Herpes is not a bloodborne pathogen, but we still need to discuss it because it presents a special concern to body artists and their customers. Body art can aggravate herpes infections, and if you're not following safe practices, you could contract it from your customers. The tattoo artist should be most concerned with herpetic whitlow, a painful herpes infection of the finger. If you worked on a customer infected with herpes and you didn't adequately protect your hands, you could contract this sort of infection. Herpetic whitlow should go away on its own, but it is highly contagious. If you become infected with a herpes virus, the incubation period usually lasts between 2 and 12 days, although symptoms of herpetic whitlow may take as long as 20 days to appear. A herpes-infected client also runs the risk of spreading the infection to other parts of his or her body. For example, a new piercing or tattoo can cause the virus to flare up in the surrounding skin areas. Normally, this wouldn't be that big of a deal, but the outbreak gives the virus an opportunity to spread to other areas of the body, including the brain. This sort of infection is extremely serious and requires immediate attention. If your client knows that he or she has herpes and is asking for work on the area where outbreaks typically occur, have him or her get an antiviral medication from a doctor. Taking this medication will help keep the virus from flaring up as a result of the procedure.
Thank you, Dr. Cohen. Now that you understand what you're up against, we'll discuss ways that you can prevent transmission of these dangerous pathogens to you and your customers.
As a body artist, your risk of infection is relatively low, especially if you are careful. Your clients, on the other hand, have a much higher risk of infection. Why? Well, remember that all pathogens require an entry point to infect their victims? When you perform body art procedures, mainly tattoos and piercings, you are essentially creating entry points on the bodies of your clients. If proper procedures aren't followed, you're basically issuing an open invitation to all harmful pathogens in the area to infect your customers. As preventative measures, we'll discuss universal precautions, that is, the creation of barriers that keep pathogens from entering our bodies, as well as ways to kill pathogens or eliminate them from objects and surfaces. Then, we'll discuss how to dispose of waste properly to limit its ability to spread disease. Finally, we'll go over the procedures for tattoos and piercings, highlighting techniques that will help you protect your clients. The term universal precautions refers to the series of practices used to avoid all contact with another person's bodily fluids by placing as many barriers as possible between the fluids and your skin. We create these barriers because, as we explained earlier, we should always assume that any body fluid is infected. Thus, the only sure way to stay free of infection is to prevent all contact with body fluids. The first barriers that should be placed are called engineering controls. Engineering controls include any equipment or machinery that can be used to help prevent exposure for all employees. For example, we'll discuss waste disposal later, but having and using special sharps waste containers will help prevent needle sticks. Employers should use any engineering controls at their disposal to make the establishment safer for employees and clients. After engineering controls have been put in place, employees will also need to create additional personal barriers. These personal barriers are sometimes called personal protective equipment, or PPE, that is, clothing or tools that are designed to protect you from getting injured or sick while working. Examples of PPE include aprons, bibs, masks, safety glasses, goggles, and gloves. For body artists like you, gloves are of the utmost importance, because you need to use your hands to do your work, but you don't want to expose them to your client's body fluids, and you definitely don't want pathogens that may be on your hands to infect your clients. Properly worn gloves create an effective barrier between you and your clients.
When it comes to choosing the right gloves, consider your many options. Most people will be drawn toward latex gloves, as they are inexpensive and allow for a broad range of hand motion. However, many people are allergic to latex, and those allergies can be quite severe, so it might be best to choose another type. If you do choose to use latex gloves, make sure to have an alternate type of glove available for those clients with latex allergies. Also, if you're using latex gloves, it's a good idea to wash your hands and change them every 20 minutes or so, as they tend to break down and become less effective. PVC gloves are also inexpensive, but they don't allow for much hand movement. You could also try nitrile gloves that are made to imitate latex gloves without causing harm to customers with latex allergies. Look around, and you will find other options available that will suit your needs and those of your customers. Whatever type you choose, gloves need to be worn during all body art procedures. Body art can be a safe experience for both you and your customer, as long as you take the necessary steps to prevent the spread of disease. Gloves can help you do that, but they only do their job if you wear them correctly. The key to properly putting on gloves is to minimize hand contact with the outer surface of the gloves. Touching the outer surface of your gloves could contaminate the glove, rendering it useless. When you grab the first glove to put it on, just barely pinch the cuff using your thumb and pointer finger. Remember, touch as little of the outside of the glove as possible. Then slide your opposite hand smoothly into the glove. Next, using your newly gloved hand, grab the second glove at the cuff and pull it over your ungloved hand. You don't need to grab it as carefully as before, as the gloved hand should be clean and free from germs. The gloves should fit snugly, neither too tight nor too loose. While wearing them, avoid touching the uncovered portion of your arm or any other part of your body or clothing. Doing so will contaminate the gloves. There's also a proper method for removing gloves. Once again, the key here is to avoid hand contact with the outer surface of the glove. In this case, to avoid contaminating your hands with any pathogens on the surface of a used glove. To start out, pinch one of your gloves near the wrist and slowly and carefully pull the glove off so that it turns inside out. Ball this glove up in your still gloved hand. Next, find a clean area on the cuff of the second glove. Slide your index finger under the cuff, grip the glove, and slowly peel it off, again so that it turns inside out in the process. If done correctly, the first glove will be tucked neatly into the second, and only the inside surface of the glove will be exposed. Make sure you throw them away in the proper container, in this case, a biohazard waste container. You'll learn more about waste disposal later in this course.
As we mentioned before, PPE can also include aprons, bibs, masks, and eye protection like safety glasses or goggles. Aprons and bibs are used to keep a person's clothes clean and safe from dangerous pathogens. They are most useful in situations where there is a risk for clothes to be splashed or sprayed with body fluids, which is unlikely to happen during a body art procedure. For that reason, aprons and bibs are most often used by healthcare professionals. Masks and eye protection are used to protect the mouth and eyes, which can become entry points for bloodborne pathogens. They are typically used by employees who may deal with spraying or splashing infectious materials. Body artists are not required to use masks and eye protection. Keep in mind that while masks prevent droplets of infected materials from getting into or out of your mouth, they do not stop airborne pathogens. Body artists who use multiple types of PPE should remember to put on and remove PPE in a specific order to avoid cross-contamination. Aprons, if you use them, should always go on first, then put on masks, and after that, eye protection. Gloves should always be put on last. When taking off PPE after a body art procedure, remove your gloves first, then your eye protection, then your apron, and your mask last. Universal precautions are vitally important, but they are not enough by themselves to prevent the spread of bloodborne pathogens. Maintaining a clean and sanitary workplace is equally important. It is inevitable that pathogens will enter your workplace. In fact, there is a good chance that you have staph bacteria on your skin right now. Once introduced to the work environment, pathogens will continue to spread from surface to surface, contaminating chairs, counters, equipment, etc., and eventually infecting people, unless you take the necessary steps to stop them. You must eliminate pathogens from any potentially contaminated surface before they get the chance to spread. This involves both preventing the spread of pathogens from one surface to another, which we'll talk about shortly, and killing pathogens that are present on a surface. There are two different processes for killing pathogens: sterilization and sanitization. Sterilization is the process of killing all microorganisms on a surface, pathogenic or not. Any reusable body art equipment that comes in contact with blood or body fluids must be sterilized between uses. This includes forceps, hemostats, and tubes, among others. Also, any equipment that may come into contact with blood or other bodily fluids, or which comes in direct contact with skin, should be sterilized between uses. We'll talk about how sterilization is done later in the course. The only body art equipment that does not need to be sterilized is that which is immediately discarded after a single use and is never reused. For example, piercing or tattoo needles must be used only once and cannot be sterilized and reused. Sterilization is not an easy thing to accomplish and simply isn't practical for large work surfaces like counters, client chairs, and so forth. This is where the second process for eliminating pathogens, sanitization, comes into play. Unlike sterilizing, sanitizing does not kill all pathogens. Instead, it reduces the number of pathogens to a low enough level that they present very little threat. We'll talk more about this, but first, let's discuss how pathogens spread.
One of the key concerns of body art procedure is avoiding cross-contamination, or the crossing of bacteria or germs from one surface to contaminate another. Any unsanitized object or surface is a potential source of cross-contamination. Think about it. When you come to work, you bring with you any pathogens that were on anything you've touched. And when you leave work, you take with you everything you've picked up during the day. Your clothing, shoes, and skin can carry all sorts of bacteria and germs they've come into contact with over the course of the day. Imagine for a minute a typical day at your work. You're in the middle of a tattoo and the phone rings. No one else is around, so let's say you decide to answer it. You reach over and grab the phone with your gloved hand. You have now cross-contaminated the phone with any pathogens that may be on your glove as a result of the tattoo procedure. The next person to pick up the phone will then cross-contaminate his or her hand, as well as anything that hand subsequently touches. Assuming the phone has not been previously sanitized, you also cross-contaminated your glove with any pathogens that may have been lurking on that phone. If you then return to your procedure, you will cross-contaminate your equipment and likely the skin of your client. Bad news. Make sure to wash your hands and change your gloves before you continue the tattoo, and sanitize the phone before anyone else can touch it. Avoiding cross-contamination requires constant vigilance. Some actions that may seem second nature, like pushing up your glasses, grabbing a pen, or scratching your nose, can all cause cross-contamination and must be avoided. If you need to do any of these things, remove your gloves first, complete the action, wash your hands, and then put on a fresh pair of gloves. Also, you'll need to sanitize any equipment or surfaces you may have touched before changing your gloves.
You can see how easily pathogens move from one surface to another, which is why sanitizing is so important. Sanitizing is done by applying an antimicrobial chemical to a surface. There are two types of antimicrobial solutions you need to know about: sanitizers, which are intended for use on non-living surfaces, and antiseptics, which are meant for use on human skin. When used properly, sanitizers kill at least 99.9% of all bacteria, fungi, and viruses present on a surface. There are many types of sanitizers available, and choosing the proper sanitizer for your needs and using it correctly is vital to keeping your facility and the people who enter it safe. When choosing a sanitizer, check out the labels. Different types of sanitizers are created to destroy different types of pathogens, and these factors will obviously make a difference. While looking at the label, make sure that the sanitizer you choose is registered with the U.S. Environmental Protection Agency, or the EPA, to ensure that it is not only approved, but also that the sanitizer will do what the label claims it will do. When using a sanitizer, it is extremely important to follow the manufacturer's instructions. Do instructions direct you to pre-clean surfaces before use? To leave the solution on the surface wet for a specified amount of time? To dilute it or use it as is? To rinse after? It is vital to pay attention to these types of details since they have the potential to drastically change the effectiveness of the sanitizer. Failing to comply with the instructions could have severe consequences. It is best to store sanitizers in the original container. Make sure the lid of the container is tightly closed and place the sanitizer in a cabinet away from food or medications. Any surface that you or your clients touch needs to be sanitized regularly. The floor should also be kept clean and sanitized as a precaution. Clean and sanitize your work area before and after each body art procedure. And even though you sanitize the area after a procedure, you will likely need to sanitize it again before working on your next client. Even the few minutes between procedures are enough to allow your work area to become unsanitary. When sanitizing an object or surface, first clean it thoroughly. Use any all-purpose cleaner to remove visible dirt and debris. Next, cover the item or surface with a sanitizing solution. You can use any number of effective sanitizers, but choose one that will not corrode the surfaces or equipment on which you plan to use it. Let the solution rest on the object or surface before wiping it away. The amount of contact time required will depend on the sanitizer used. Make sure to read and follow the instructions on the label. After the appropriate contact time has passed, wipe the sanitizer away with a disposable sanitary paper towel. The object and surface should now be safer and less likely to transmit disease. Note that disinfectant wipes and any common cleaners that do not kill pathogens are not suitable sanitizers for body art procedures.
You won't likely encounter the need to clean up large amounts of blood. However, if you do, you must carefully follow sanitation procedures. First, make sure to put on gloves to protect your hands from being contaminated. Next, cover the spill with paper towels and pour carefully to avoid splashing a bleach solution over the towels. Let the spill soak for at least 5 minutes before you collect all of the towels and dispose of them in a biohazard waste container. Finally, wipe up the area with clean paper towels. If there is broken glass in the spill, make sure to first disinfect the entire spill before cleaning up the mess. Use forceps, pliers, or a broom and dustpan to remove any broken glass. Never use your hands to pick it up. Dispose of the glass in the appropriate waste container and continue to sanitize the spill area as described before.
Similar to sanitizers, antiseptics are made to destroy harmful pathogens. Unlike sanitizers, however, antiseptics are made to cleanse living tissue, namely your skin. Common examples of antiseptics are antimicrobial soap, iodine, and rubbing alcohol. As with sanitizers, there are a number of antiseptics to choose from, so choose wisely. When choosing your antiseptics, consider how you will be using the chemicals and the safest, most effective, and most efficient way to do so. For example, choose antiseptics that will avoid drying out the skin, but also allow the skin to breathe as well. Finding this balance in the antiseptics you use is important for your clients and for the success of your facility. You should always use an appropriate antiseptic to thoroughly clean the area you will be tattooing or piercing to prevent any health risks. Swab the area using a circular motion and do not touch the area with your hands afterwards. Store antiseptics in a cabinet away from food and medicine. While you may want to store your antiseptic in a pump bottle for use with cotton balls, you may also consider storing it in its original bottle. If you choose to keep it in the original container, pour the amount you will need into a smaller paper cup for each use and discard any leftovers when you are done. Both of these storage methods will help prevent contamination.
As important as it is to keep your equipment and work area sanitized, it is just as important to keep your hands clean and sanitary. Washing your hands is an essential safety procedure for body artists. Wearing gloves is no excuse for neglecting to wash your hands. Proper hand washing technique is easy to learn and can significantly reduce the spread of infectious diseases. Change your gloves and wash your hands whenever you switch tasks, like when you have to step away from a tattoo procedure to get more pigment. We'll now show you a short video that will demonstrate and explain proper hand washing technique. In any body art parlor, each employee plays an important role in preventing the spread of bloodborne pathogens, and keeping your hands clean is an important part of that process. As you move from task to task, make sure that you regularly change your gloves and wash your hands properly. First of all, wet your hands in warm water. The water shouldn't be hot enough to burn you, but it should be as warm as is comfortably possible. Next, apply soap to your hands and begin vigorously scrubbing your hands, wrists, lower arms, and the areas under your fingernails for at least 10 to 15 seconds. Some people like to sing a short song or say a nursery rhyme to make sure they scrub long enough. If you sing the alphabet song just through the end of the list of letters, that should be enough time for effective scrubbing. When you are finished, rinse the soap from your hands with water. Finally, dry your hands using either a disposable paper towel or a warm air dryer. All in all, the process should take at least 20 seconds. Please do not skip any of these steps. Keeping your hands clean by washing them properly will keep your customers safe.
Sanitizing your hands with an alcohol gel does not replace hand washing, although it may be used as an additional precaution. Hand antiseptics help reduce the number of pathogens on your hands, but they do nothing to remove dirt and oil on your hands that only hand washing can successfully remove. So if you use hand antiseptics, make sure you wash your hands first. To sanitize your hands, apply the directed amount of antiseptic to your hands. Rub all the surfaces of your hands together thoroughly, including between your fingers. Continue rubbing your hands together until they are dry.
Most people don't have to worry about proper disposal of waste at their jobs. They just have to throw their trash in the trash can. No big deal. But as body artists, you must be more careful than that. Why? Well, first of all, any waste that has come into contact with any body fluids could present a risk to anyone who might accidentally touch it later, including sanitation workers. Also, some of the waste that you will produce on the job will be particularly dangerous. Sharp needles used for tattooing and piercings. Not only can these objects carry pathogens, but their sharp tips ensure that exposure to the diseases they carry will come with a custom-made entry point. As a result, you must take special precautions to properly dispose of all waste. For a start, you will need to use 3 separate waste containers. These containers are for traditional waste, biohazardous waste, and sharps.
A proper sharps waste container is one that is puncture resistant and clearly marked as a container for sharps waste only. These containers should be located within arm's reach of the body artist during every body art procedure. Sharps containers must be leak resistant and very difficult to reopen once they've been sealed. Needles and other sharp items, including disposable razors, need to be disposed of in this container. When the container is 3/4 filled, it should be considered full. Trying to fit just one more needle in a sharps container is a good way to get hurt. Also, never reach into a sharps container for any reason. The entire container should be discarded according to proper biohazard waste procedures. Biohazardous waste is waste that has a high probability of spreading disease-causing pathogens. Contact your local waste management provider for information on the pickup of biohazardous waste, including sharps. Body artists must also document all sharps waste disposal at their facility, and these records need to be kept for 3 years. If an enforcement officer requests to see these records, you are obligated to provide them. Based on the definitions in the California Medical Waste Management Act, sharps are the only biohazardous waste you'll be likely to generate during body art procedures. This means you probably won't be required to maintain other biohazard waste containers, although you may want to check with your local regulatory authority to make sure. Even if you aren't required to have a biohazard waste container, it isn't a bad idea to have one available in case it is ever needed. The biohazard waste containers should be clearly labeled as containing biohazardous materials and use only traditional red biohazard garbage bags. The bag should also be clearly labeled as containing biohazards. Any fluid blood or any container or equipment containing fluid blood must be discarded in the biohazard waste container. As a body artist, you will likely only encounter small amounts of blood that are not still fluid by the time they are thrown away. However, just because a bit of blood soaked into a paper towel doesn't meet the official definition of biohazardous waste doesn't mean it can't carry dangerous bloodborne pathogens. Generally, anything that touched or may have touched human body fluids or potentially contaminated skin or surfaces should be handled with care, and you may choose to discard such items in a biohazard waste container as an added precaution. Materials that you may want to dispose of in this manner include protective gloves, paper towels, plastic protective covers, pigment caps, and leftover pigment, cotton swabs, and leftover ointment removed after use. The traditional waste container will hold everything that doesn't need to go in the sharps or biohazard waste containers, including anything that comes from paperwork, food, hand washing, etc. Any standard trash can and bag will work for these items. Just make sure the trash can is marked in some way to indicate that it's for non-hazardous waste. Remember, never place anything sharp in the biohazard or traditional waste containers. Sharp items should be disposed of safely in the sharps container only. It's important that you create a sanitary environment for each procedure. The way you set up your equipment is vital to prevent the spread of disease. When you're setting up for a procedure, make sure that you're wearing gloves. This will ensure that you don't contaminate any of the items that you're planning on using. Clean the area thoroughly with an EPA-registered germicide or sanitizing solution. Cover the area appropriately. Plastic wrap works great since it's non-porous, meaning it won't let air or liquids pass through, but you may opt for a paper towel or tray cover instead. Set out all the tools and materials you will need for the procedure. As you're doing so, remember this principle. Anything used during the procedure should either be thrown away or sterilized when the procedure is over. That's why you put your ink in small disposable cups, so you don't have to throw away an entire bottle after the procedure. Similarly, it would be best to use ointment in single-use disposable packaging, but if you get an ointment from a large container or stock supply, be very careful to avoid contamination. Remove ointment from the supply in a sterile manner. For example, by using a sterile single-use tongue depressor. Remove enough for your entire procedure. You should avoid having to get more out, as it can be complicated to do so without cross-contamination. Single-use razors and other equipment you need should also be laid out on the clean surface for the procedure. Keep anything in sterile packages unopened until the customer is ready and open these items in front of him or her. As I said earlier, all needles must be single-use, but on top of that, check to make sure each one is free from barbs. Barbs are defects in the needle that stick out from the surface. These can cause unnecessary damage to your client's skin. Because a sanitary environment is so important to keeping body art procedures safe, no animals may be allowed in the procedure area, except for service animals like guide dogs. When you're finished setting up, remove your gloves, wash your hands, and put on a fresh pair. To begin a tattoo procedure, shave the area with a single-use razor and then cleanse the skin with an antimicrobial soap. Sanitarily applying rubbing alcohol with a clean swab using a circular motion will also help cleanse and prepare the skin area. If you choose to use alcohol as your antiseptic, store it in a pump and pour out the amount you will need for each procedure into a paper cup to avoid contaminating the entire bottle. Using an antiseptic is important for preventing strep or staph infections. The stencil needs to be placed with a single-use disposable template, or, for those of you who do freehand design, make sure you are using a single-use non-toxic marker. As you make the tattoo, remember that anything used in the procedure should be considered as potentially contaminated. As a result, those materials must either be thrown away or sterilized at the end of the procedure. If you need to obtain more ink or ointment from a stock supply, pause the procedure, remove your gloves, wash your hands, prepare the necessary materials, wash up, and put on fresh gloves before resuming the procedure. It's a time-consuming process, but that's why you should do all you can to set out all necessary materials before first beginning the procedure. Because a tattoo needle moves so quickly, any blood that comes in contact with it can easily be turned into a mist. This misting can cause anything positioned beneath the needle to become contaminated. For this reason, anything beneath the procedure, perhaps under the counter or tray on which your equipment rests, needs to be thrown out or sterilized at the end of the procedure. Position your ink bottles and other stock equipment above the level of the procedure so you don't have to worry about them being contaminated by misting. After the tattoo is finished, you'll need to protect the tattoo from infection. You may do this by putting a thin coat of antibiotic cream or petroleum jelly and sterile gauze over the tattooed skin. Each parlor follows its own procedure. Just make sure that a protective barrier is placed between the new tattoo and anything that might cause infection. When performing a piercing procedure, follow the same safety principles that were discussed in the tattoo section. Make sure that you are set up and ready to go before the client arrives. Remember that piercing guns may not be used to pierce body parts other than the earlobe and ear rim. For all other piercing procedures, use a single-use piercing needle of a slightly larger gauge than the ornament being placed. Ornaments need to be made of implant-grade stainless steel or solid 14-karat gold. All other reusable items used in placing a body piercing need to be sterilized between each use.
Body art safety begins in the parlor, but it doesn't end there. If your clients are not careful, they could contract serious bloodborne diseases in the days and weeks following their procedures. Remember, body art procedures create entry points for pathogens on the bodies of your clients. Part of your job is making sure that they have the information that they need to protect these entry points until they have sufficiently healed. For this reason, you must instruct all of your customers on proper post-care procedures. When your clients leave the parlor, you'll give them a list of post-care instructions for protecting and treating the surrounding skin. You might be tempted to just give them the list and send them on their way, but it is crucial that you take the time to review the information with them. You need to make sure that they clearly understand the post-care procedures your establishment recommends. I know, you're a body artist, not a teacher. But giving post-care instructions is really quite simple, and you'll quickly get the hang of it. To give you an idea of what we mean, we're going to give you a chance to walk a mile in your client's shoes. We're going to pretend that you have just received a tattoo or a piercing, and you are now receiving instruction on post-care treatment. To get started, we'll need to create a virtual you. We just need you to answer a couple of questions so that we can create your virtual character. Tell us how old you are. Of course, if you wish you were 20 years younger, feel free to choose that age. This is just for fun. You'll also need to select a gender, skin color, and hair color for your character. When you have finalized your choices, click Next. Finally, we're going to let you pick out your own body art. Ah, you've decided to go with the tattoo of a dragon on your face. An excellent choice, I must say. Tony, your experienced body artist, will now go over post-care procedures with you.
I hope you like your new tattoo. I've done all I can to make your body art experience a safe one. I used sterilized equipment, wore clean gloves, and avoided cross-contamination, but the battle against bloodborne pathogens isn't over yet. You'll have to take good care of your tattoo and the surrounding skin to make sure that the area doesn't get infected before it is properly healed. I've bandaged the tattoo to protect it from pathogens. In 1 or 2 hours after you leave today, you'll have to remove that bandage and delicately wash the tattooed area with antibacterial soap that is neither perfumed nor dyed. Then pat it dry and apply ointment to the tattooed skin. You need to use an approved ointment for this because some ointments could actually mess up the tattoo by drawing the ink out of your skin. You can buy some approved ointment here from the parlor, or I can give you a list of approved ointments and you could pick it up at a drugstore. Also, make sure to use a very thin coat of ointment because while you want to protect your skin, you also want to let it breathe. Keep the tattoo hydrated with the ointment until the skin is completely healed. This can take around 3 weeks. Until it is fully healed, do not soak the tattoo in water of any kind. That means no swimming. You can shower, but don't place the tattoo directly into the water stream. Also, remember that you shouldn't expose the tattoo to excessive sunlight. Definitely do not do any tanning until that tattoo is healed. After a few days, the tattoo will start to scab or peel. Don't worry, it's part of the healing process. Do not scratch the tattooed skin. You don't want to remove the scabbing or break the skin. This can lead to infection. Throughout the healing process, you'll have to watch closely for any signs of infection. If your tattooed site does become infected, it's important that you find it and treat it quickly. If the area swells, turns red, and is tender to the touch, it might be a staph infection. Fever, fatigue, and other flu-like symptoms could be a sign of a more serious infection like hepatitis or even HIV. Other signs of infection include a yellowing of the eyes or skin called jaundice, headaches, blisters, and rashes. If you think you might be infected, don't hesitate to see a doctor. It's always better to be safe than sorry. Also, give us a call so that we can be aware of the possible contamination problem. We also need to know so that we can notify the health department. Everything I've explained to you is on this post-care instruction sheet. along with a few other helpful tips for protecting yourself from infection. If you have any questions, don't hesitate to give me a call. My name and number is at the bottom of the sheet. That's it. You're free to go. Remember that you need to take that bandage off and clean the tattooed skin in an hour or two. Thanks for coming in.
When the procedure is over, throw away all disposable materials and clean up any spills or visible contamination. Anything touched during the procedure is no longer sterile or sanitary and must be thrown away or properly sterilized. The items you will be sterilizing should be put to pre-soak. Then, after washing your hands and putting on fresh gloves, sanitize your work area. Once the area has been cleaned and sanitized, you may want to set up for the next client. If so, make sure to wash your hands and change your gloves first. The first step in sterilization is what we call the pre-clean step. In this step, you remove any visible debris or residue from the item that you will be sterilizing. This is why you pre-soak the items, so any proteins and debris can start to break down. To start the sterilization process, clean each object manually using a mild detergent and cool water. You will likely need to use something like a cotton swab to help clean off any debris. You should then place the objects in an ultrasonic cleaning unit, or sonic bath. These devices use detergents and ultrasonic water to clean the objects placed inside them. Be careful when using a sonic bath, as these devices can cause particles to fly into the air. Read all the manufacturer's instructions before using a sonic bath, and make sure that the lid is securely attached while in use. The purpose of the pre-clean step is to make sure that you completely remove any blood and tissue that might be on the item before sterilizing it, as the other steps won't remove proteins from objects, which can result in allergic reactions for future clients. Number 2. After you have pre-cleaned an item, allow it to dry on either a drying rack or a clean towel. Items must be dry before continuing with the sterilization procedure.
Once an object has been pre-cleaned and dried, it is ready to be packaged for sterilization. Package each item in an individual sterilization package and label each package with the name of the instrument being sterilized, unless you can easily tell what it is from the outside of the package, the date, and your initials. You may place more than one item in a sterilization package only if the items will be used at the same time. If you later decide to only use one item in a sterilized package, you will still have to re-sterilize the other objects in the package. Also use a sterilization integrator, a strip of color-changing chemical indicator, inside each load of equipment to be sterilized, so you can later confirm that the objects have been successfully sterilized. To sterilize your packaged equipment, use an autoclave or other pre-approved sterilizing device. Under the California Safe Body Art Act, only equipment manufactured for sterilizing medical equipment may be used. Autoclaves use steam under pressure to sterilize items, usually taking about 30 minutes. Make sure to run what is called a spore test at least once a month to make sure that your autoclave is operating safely. Also, read the owner's manual to make sure you operate the autoclave properly. Sterilizing your equipment can be a time-consuming process, but doing it carefully can save lives. To ensure that equipment is properly sterilized after each use, you must keep a sterilization log. Create an entry in the log every time you sterilize a piece of equipment. In each entry, include the date, the quantity and type of instruments being sterilized, and the name of the person who sterilized the items. If you ever have a problem and you keep a careful log, you may be able to find out where things went wrong. Keep old logs for at least 3 years, and if an enforcement officer asks to see these logs, you must provide them. Remember, sterilized objects will not stay sterilized forever. If the objects aren't used within a reasonable time after sterilization, it would be a good idea to sterilize them again before use. Also, if you see any staining on the package after sterilization is complete, that is a sign the object wasn't properly cleaned before sterilizing it. Repeat the entire process for objects in stained packaging. Despite your best efforts to avoid exposing yourself to infected body fluids, an exposure incident may still occur. An exposure incident is an event in which your potential for infection is heightened after coming into contact with another person's blood, body fluids, mucous membranes, or broken skin. Exposure incidents fall into 3 categories. First, if you are poked or cut by a potentially contaminated needle or other sharp. Second, if blood or other potentially infected material comes into contact with your eyes, mouth, or mucous membranes. Third, if blood or other potentially infectious material comes into contact with broken skin. Such incidents come in many forms. Say, for example, that you fail to wear gloves while giving someone a tattoo or a piercing. Your hand could easily come in contact with the blood of a client that may have a bloodborne disease. If you happen to have a cut or scrape on your hand, you could be exposed. Or what if you throw used needles into a garbage can rather than an approved sharps container? You could be poked by an infected needle when taking out the trash. While there are many ways you could become exposed to bloodborne pathogens while you work, these are just a couple of examples. Exposure does not always result in infection. According to the CDC, those who have received the hepatitis B vaccine are at virtually no risk for HBV infection, while those who are unvaccinated have a 6 to 30% chance of infection from a single needle stick or cut exposure, depending on the concentration of the virus in the infected blood. That's anywhere from a 1 in 20 chance to a 1 in 3 chance. Studies on the infection rate from exposure to hepatitis C are limited, but estimates indicate a 1.8% chance of infection, or about a 1 in 55 from a needle stick or cut. The risk of HCV infection from a blood splash is believed to be very small, though infection from such exposure has been reported. The infection rate for needle stick or cut exposure to human immunodeficiency virus is 0.3%, or about 1 in 300. For exposure to the eye, mouth, or mucous membranes, the chance of HIV infection is about 0.1%, or 1 in 1,000. The risk of HIV infection from blood to skin contact is low. A small amount of blood on intact skin for a short amount of time poses no threat, but the risk increases if the skin is damaged, if the contact involves a large area of skin, or if the contact is prolonged. Those may sound like pretty low odds, but consider the devastating effect infection could have on the rest of your life. Even a 1 in 1,000 chance of being infected with HIV is worth taking every reasonable precaution to prevent. Of course, you should always do what you can to avoid exposure incidents, but when an incident does occur, there are steps you can take to lower your chances of infection even further, which we'll talk about as part of an infection prevention control plan. The state of California requires that body art facilities have an infection prevention control plan, or IPCP, in place. An IPCP should include procedures for recognizing, preventing, and dealing with exposure. At minimum, the IPCP must include the following procedures for preventing bloodborne pathogen exposure, many of which we have already discussed in this course. Sanitizing work and environmental surfaces, sterilizing, packaging, and storing reusable materials, setting up before and cleaning up after any body art procedure, preventing contamination of instruments and procedure sites during any body art procedure, safe handling and disposal of sharps waste. A thorough IPCP plan should also tell you to whom you need to report your exposure, as well as when and how you should make that report. The IPCP should also have information on the proper follow-up procedures for you to follow, as well as any forms you may need to fill out. OSHA also requires that jobs where employees may come in contact with blood or body fluids have what is called an Exposure Control Plan, ECP. For more information, check out the learning extras on the right-hand side of your screen, where you'll find several helpful links. There is an additional slide outlining the basic steps of an ECP, an OSHA manual that will walk you through the step-by-step creation of an ECP, a fictional example of an ECP put together using OSHA's method, and an example ECP provided by the California Department of Industrial Relations.